So what we are going to do is we're going to briefly talk about the units which are used to measure range of motion. And I'm going to do that by going into an evaluation tab on the left-hand side. So we've seen so far the treatment tab. Now we're going to see the evaluation tab. And we're going to take fingers range of motion. And obviously we're using the HandTutor. Now, when I make a fist, okay, and open my fist, I can see these units here growing, okay, or getting bigger. Okay, so I'm just going to reset that for you here. Here we are, 0, and when I make a fist, those units get bigger or increase. Now those units are millimeter measurements. It's a ruler measurement. Now what that is a circumferential measurement. Now this is a odd-stock wire measurement, which is a validated ruler measurement, which was validated, and it's a PubMed publication from the 1990s, from the early 1990s, from the UK, looking at orthopedic surgery. It was on a subset of orthopedic patients. And they were looking at a multi-joint functional grip, okay? So we're not looking at each individual joint. The sensors take all of the joints together. That's the MCP joint, the PIP joint, and the DIP joint. So we're all together taking those as a functional measurement. And how that works is if you take from the wrist crease to the tip of each finger, okay, that will be the shortest circumferential measurement. When we make a fist, we elongate it, okay? So if we measure now the circumference all the way around, it's longer. So from here to here, it's longer. How much is longer is the number of millimeters, is the ruler measurement for all of those joints. So if we press reset when we're at full extension and then make a fist, we get that maximum circumferential increase in millimeters from the 0 position, which is the shortest, from the wrist crease to the tip, which is the shortest. As we're making a fist, that increases in size, and then we get the ruler measurement. So in the evaluations, we can measure both a passive and an active range of motion using the odd-stock wire or ruler measurement. How we do that is we have a technique for passively making a fist, then bringing the wrist into flexion, then opening the fingers while we're in full flexion, and then bringing the hand out and the wrist out. Again, we can make a fist while we're in full extension, bring the wrist all the way in to full flexion, open the fingers passively while we're in full flexion, and then extend the wrist and the fingers together. Make sure that the thumb is also extended as well. And when you've made that fist, make sure that you're bringing that thumb in across the fingers and then down. So that will be the full passive range of motion of the client. Now we want to see what the active range of motion is within that passive range of motion. Okay? Now to do that, we are now going to, we're still in the passive range of motion, which is the blue range of motion. We're going to ask the client to try and make a fist and to try and move their wrist in, and then to try and open their fingers and move out. Okay, so I'm going to ask them to cycle within that passive range of motion, okay, as much as they can. And then I'm going to move on to the next, and I'm going to ask them now to try and make a fist as much as possible, to try and bring their wrist in as much as possible, okay, and you can see here that I'm covering as much as possible that passive range of motion. And then I'm going to ask them to open and bring their wrist out as much as possible. So let's go back and let's do that again. So we're going into the fingers. Okay, so we're going into the fingers, range of motion. We're picking the fingers. Now we have the technique for building that complete passive range of motion. So we're bringing all our fingers in passively into full flexion, bringing our thumb into full flexion, bringing our wrist down into full flexion. And then while we're in that full flexion, we can open up the fingers to our maximum, and then we can bring the wrist out to our maximum, okay? So that will bring us to a full passive range of motion. Then before we press next to measure the active range of motion, I ask the client to try and make a fist and bring their wrist in, and then from that point to do the same movement to try and open their fingers while their wrist is in and try and bring their wrist out. And you can ask them a couple of times to do that before you actually take a measurement for the active range of motion. Then I press next and again ask them to try and make a fist as much as possible, to bring their wrist in as much as possible, to open their fingers as much as possible, to bring their wrist out, and maybe even remind them to try and get their thumb in and their thumb out as much as possible. Now, once I'm satisfied that they can't repeat and get more range of motion in their active range of motion, I can then press finish. Now, what we've recorded now is the blue lines, which are giving us the passive range of motion. And within those blue lines, we have this green, which is the active range of motion. So we have a total displacement of the green. So if we look, for instance, at the little finger or the pinky, we can see that the passive blue is 16 millimeters and the active green is 6 millimeters. Now the deficit in extension, that means from the position of the fingers within that circumference to the shortest point, which is when the fingers are completely straight, is our active extension deficit. So we can see that that is 2 millimeters. And the active flexion deficit, we can see here, is 8 millimeters. So that gives us our deficits in active flexion and active extension. And of course, we can annotate that by putting our comments in here. And then once we're happy with that and we've annotated, we can press save. Now that data is now saved to the patient dashboard or to the patient datasets. And by clicking on the report, we can then highlight the report that we wish to see, which is that range of motion, and we have a graphical report now of that range of motion. So what we see in the graphical report again is for each of the fingers, the full passive range of motion. We see the full active range of motion, and then we see the deficits. Okay, and that will be divided up into extension deficit and flexion deficit with different keys, and it's also annotated as well. We're going to move on now to the second evaluation which we can do, which is the motion analysis. So we have a second list of evaluations, which is the motion analysis. So if we click on the motion analysis fingers, obviously we have to be working with the HandTutor. Now we have a evaluation which will actually document and record my movements. So I'll actually be able to see a graph of my movements, and I can set how much time I want to use for this record. The default setting is 15, but it depends on the patient's ability. So if they have good ability, I might want to increase this reporting time or recording time, or poor ability, I might want to decrease the recording time. So I'm going to give a certain instruction to my client. I'm going to tell my client to please try and close and open your fingers to your maximum ability, how much you can possibly do, but try and make this as regular as possible. Okay? So try and keep those cycles as regular as possible. So I give them a couple of practice ones to begin with, and then I'm going to press the next button or the go button. And we're going to now populate, and we're going to see here a recordings, which is the actual recordings of all of the fingers together over that 15-second time. Now, if we have a look at those recordings, we'll be able to see that the up line is the extension of the fingers and the down line is the flexion of the fingers. And we have a visual interpretation here about two sets of homogeneity. One, we can have a look and we can see whether the patient could manage to do a regular cycle time, whether there was the same amount of speed on extension as there was in flexion. And then if we take a line down, going from finger to finger, we can see if there was a homogeneity across the fingers, whether some of the fingers perhaps were delayed, okay, in their movements. What we can also see is the max range of motion. That's the max ruler measurement for each of the fingers, range of motion of each of the fingers. And we can see what the repetition time was, or what were the frequency of repetition time. Now, if I gave an instruction and wanted the patient to try and repeat as quick as possible, but keep that homogeneity as well, then what the instruction was, I can place here in the report, in the note-taking. So that will make the maximum repetitions make sense, because my instruction was to try and be as quick as you can, try and give as quick a cycle speed as you can. So therefore, my reporting of the maximum number of repetitions the maximum number of repetitions during the evaluation will be the indication of the patient's burst speed ability, how quickly he could open, how quickly he could close. So again, this motion analysis is a tracing of each finger by finger movement, and it allows me to look at various movement abilities. As I mentioned, homogeneity. As I mentioned, maximum range of motion. And of course the maximum speed, and see whether there was elements of fatigue coming in, and see whether there was a difference in speed of extension relative to flexion, and see whether there was any delay or some fingers not being able to close at the same pattern as the other fingers. And again, once I have that information, I can then save it, and that will save that into my reporting. So I can go to the patient dashboard, I can go to my report section and I can bring up that motion analysis report. Again, that motion analysis report is going to give me the max range of motion for each finger by finger, and it will give me an indication of the repetitions. And again, I can document what I saw as I saw them in the tracings on this report, and I can print this report. Now we have various options at the top. So we can sort the evaluations we've done by time. We can sort them by evaluation type, whether it was a range of motion evaluation of the hand, or whether it was a motion analysis evaluation, or we can sort as well by device. It's also possible for us as well to have a look at what we call an accumulative evaluation. So we can take 2 periods of time and compare them to each other, 2 or even 3 periods of time and compare them to each other. So what we're going to do is we're going to compare the range of motion for an arm tutor on the left side, and we're going to so this is the report that we're going to get, which is the passive range of motion and the active range of motion and the deficits of that range of within that range of motion, the deficits in extension and the deficits in flexion. And we're going to compare that in a cumulative way to a range of motion done on the 13th of May. So what we see here is a line here looking at the passive range of motion and a line here looking at the active range of motion. And what we will expect is that the passive range of motion stays the same, okay? And we should be seeing an increase in the active range of motion within that passive range of motion. And of course, we can then annotate that report and print that report.